Did you know that over 1 million sexually transmitted infections are acquired every day worldwide? It's a staggering figure that underscores a critical global health issue. Sexually transmitted diseases, or STDs, do not discriminate. They can affect anyone, regardless of age, gender, or social status, making universal awareness and education essential. Many hold the misconception that STDs are confined to certain groups of people, or that only the promiscuous are at risk. This is far from the truth. STDs can be transmitted in various ways, not just through sexual intercourse. Activities including intimate skin-to-skin contact can also spread infections, which means that anyone could be vulnerable without proper knowledge and precautions. The impact of STDs extends beyond individual health. They strain healthcare systems, affect economies, and can lead to serious health complications if left untreated. The need for comprehensive sexual education and open conversations about STDs has never been more apparent. Understanding STDs is the first step towards prevention. Let's dive deeper. What exactly are STDs, and which ones should you be most aware of? Let's dive into some of the most common sexually transmitted diseases: chlamydia, gonorrhea, herpes, and HIV. Starting with chlamydia, it's one of the most widespread bacterial STDs and is especially prevalent among young adults. It's transmitted through sexual contact, and the tricky part is it often doesn't cause any symptoms initially. When symptoms do occur, they might include pain during urination or an abnormal discharge. The silent nature of chlamydia can make it particularly dangerous, as it can lead to serious reproductive problems if left untreated. Next, let's talk about gonorrhea, another bacterial STD that's quite similar to chlamydia in its transmission and lack of initial symptoms. When symptoms manifest, they can be quite uncomfortable, including burning sensations during urination and increased discharge. Like chlamydia, gonorrhea can cause significant complications if it goes unnoticed and untreated. Moving on to herpes, caused by the herpes simplex virus. There are two types, HSV1 and HSV2, both of which can cause sores and blisters around the mouth or genitals. Transmission can occur through direct contact with an infected person, even if no sores are visible. Herpes is chronic, meaning once you have the virus, it stays in your body, though symptoms can be managed effectively with medication. Finally, HIV, or human immunodeficiency virus, attacks the immune system and can lead to AIDS if not managed properly. HIV is transmitted through bodily fluids, which includes blood, semen, vaginal fluids, and breast milk. Early symptoms might mimic the flu, including fever, sore throat, and fatigue, but as the virus progresses, it severely weakens the immune system. Each of these STDs highlights the critical importance of safe sexual practices and regular testing. Recognizing symptoms early can lead to better outcomes, but prevention is key. Once an STD enters your system, what happens next? Sexually transmitted diseases, or STDs, can take a toll on your body in ways that aren't always immediately apparent. When these infections are introduced into the body, they begin to disrupt normal bodily functions, particularly targeting the immune system. This can make it harder for your body to fight off other illnesses, leading to increased susceptibility to infections. In the short term, symptoms might include anything from mild irritations or discomfort to severe pain and fever. These symptoms are your body's initial response to the infection, attempting to rid itself of the intruding pathogens. However, the visible and immediate effects are just the tip of the iceberg. Over the long haul, if left untreated, STDs can lead to more severe health complications. For example, certain strains of human papillomavirus, or HPV, can lead to cervical cancer in women, while untreated syphilis can cause neurological and cardiovascular damage. Gonorrhea and chlamydia can lead to pelvic inflammatory disease in women, which might result in infertility. HIV is another grave concern. It attacks the immune system directly, reducing its efficacy and leaving the body more vulnerable to a wide range of diseases, including many that could be otherwise easily managed. Understanding these effects underscores the importance of early detection and treatment. The journey from infection to these severe consequences isn't inevitable. With timely intervention, most STDs can be treated effectively, reducing or even eliminating long-term risks. The effects of STDs can be severe, but many can be managed with proper treatment. How can you protect yourself and your partners from STDs? This pivotal question leads us to perhaps the most crucial aspect of sexual health: prevention. Prevention is invariably better than cure, particularly when it comes to sexually transmitted diseases. One of the simplest yet most effective methods to prevent the spread of STDs is the proper use of condoms. Condoms, when used consistently and correctly during any form of sexual activity, act as a barrier that reduces the chance of transmission by blocking the exchange of bodily fluids. Another protective tool, though less talked about, is the dental dam. This is a square piece of latex used during oral sex to cover the genitals or anus. Like condoms, dental dams minimize direct contact and greatly reduce the risk of transmission. But prevention doesn't stop at barrier methods. Regular STD testing plays a fundamental role. It's essential for everyone who is sexually active to get tested regularly. This not only helps in early detection and treatment, but also prevents the spread of STDs to others. Knowing your status and that of your partner can lead to informed decisions about your health and sexual activities. Vaccinations are another cornerstone of STD prevention. Vaccines are available for certain STDs, including human papillomavirus, HPV, and hepatitis B. HPV is a major cause of cervical cancer among women, and a vaccine can significantly reduce the risk of this disease. Similarly, the hepatitis B vaccine provides protection against a virus that can cause long-term liver infection. It's important to have open and honest conversations about sexual health with your partner. Discussing past test results, the use of condoms or other barrier methods, and vaccination status can enhance trust and ensure mutual protection. In conclusion, while the landscape of STDs may seem daunting, the power of prevention is mighty. By using barrier methods like condoms and dental dams, staying on top of health through regular testing, getting vaccinated, and maintaining open communication with sexual partners, everyone can take significant strides towards safety and health. Taking proactive steps in prevention can drastically reduce your risk of contracting an STD. Think you might have been exposed to an STD? Here's what you should do. First and foremost, it's important to understand that regular testing is key, not just when you believe you've been exposed, but as a routine practice. Regular screening can help detect an infection you might not even know you have, since many STDs can be asymptomatic. Let's walk through the common procedures for STD testing. Typically, testing involves providing a urine sample, blood test, or a swab from the genital area. These methods are straightforward and quick. For instance, a blood test can check for HIV, syphilis, and hepatitis, while a swab test is commonly used to detect chlamydia and gonorrhea. Now, you might wonder about privacy. Well, the good news is that STD testing is highly confidential. Clinics and health professionals are bound by strict privacy laws, so your results won't be disclosed without your consent. This means you can get tested without any fear of unwanted disclosure. Many health clinics, community health centers, and even some pharmacies offer STD testing. They often provide this service at low or no cost, depending on your insurance coverage or financial situation. So, accessibility should not be a barrier. Remember, understanding your health status isn't just about peace of mind, it's about taking control. By getting tested, you're not only looking after your own health, but also protecting those around you. Getting tested is a simple step that plays a crucial role in your overall health. Positive diagnosis? Let's explore what comes next. When faced with the challenge of a sexually transmitted disease, understanding your treatment options is crucial. The good news is, for every type of STD, there are treatments available that can help manage symptoms and, in many cases, achieve a cure. Starting with bacterial STDs such as chlamydia, gonorrhea, and syphilis, the primary treatment is antibiotics. It's vital to take the full course of antibiotics prescribed by your healthcare provider, even if symptoms disappear quickly. This ensures that the infection is completely eradicated and reduces the risk of developing resistance to the antibiotics. For viral infections like herpes and HIV, the approach shifts to antiviral medications. These don't cure the virus but play a crucial role in managing symptoms and reducing the risk of transmission. In the case of HIV, antiretroviral therapy can suppress the virus to undetectable levels, which means it's no longer transmittable to sexual partners. A strategy known as U=U, undetectable equals untransmittable. Treating STDs isn't just about taking medication. It involves comprehensive sexual health care. Follow-up appointments are a key part of the treatment process. These visits allow health professionals to monitor the effectiveness of treatment, check for any side effects, and ensure that the infection has been fully treated. Moreover, it's essential to inform any recent sexual partners about the infection so they can also seek testing and treatment if necessary. This can be a difficult conversation, but it's a crucial step in preventing the spread of STDs. Remember, each STD and individual requires a unique treatment plan. Always consult a healthcare professional who can provide tailored advice and treatment options based on your specific condition. Effective treatment exists, and with the right medical guidance, you can manage or even cure many STDs.